Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hi, welcome back to Clinical Clips. This is episode 2 for CHEST 2023. I'm here live in Honolulu, Hawaii, covering the annual CHEST meeting, and I want to share a few abstracts with you. If you were with me yesterday for episode 1, this is part 2, and if not, go back and have a look at episode 1 and then come back and see me here. The first presentation I'd like to share with you comes from a group that evaluated sarcoid-associated pulmonary hypertension with treatment using riociguat versus placebo. The group commented on the fact that sarcoidosis-associated pulmonary arterial hypertension has been elusive in clinical trials because of its relative rarity and the comorbidities involved with the inflammatory and fibrotic components of the pulmonary hypertensive response. So nevertheless, this group did probably the only randomized placebo-controlled trial that we've seen using riociguat versus placebo in patients with sarcoid-associated PAH. And what they found out is that there was a significant improvement in time to clinical worsening in the patients who were on drug versus placebo. In addition, out to at least a year, the change in 6-minute walk for most of the patients on riociguat was at least 30 meters, whereas only 1 of the 8 patients on placebo had a 30-meter improvement. The net gain was something in the order of plus 30 meters versus minus 55 meters for the placebo. So this really is kind of a proof of concept study that reinforces that riociguat not only is an effective drug for PAH, but in the subset for sarcoid-associated PAH may be beneficial for those patients as well. The next presentation comes from a group involved with the PV-domics study, and this is the pulmonary vascular disease phenomics, essentially deep phenotyping of pulmonary vascular disease patients. And it's part of the theme of today's episode 2 of the Clinical Clips, because this tailored therapy that we all strive to achieve for patients who have different subtypes, different phenotypes of pulmonary arterial hypertension is where we're trying to target. So this group actually looked at the difference in ground glass opacities that were present or absent in a group of patients in the PV-domics study that looked at outcome with those with ground glass opacities compared to no ground glass opacities, and the outcomes were worse. They had worse hemodynamics, there were more female patients, and they had more use of prostanoids, they had longer disease duration, so an overall worse population. And I think what this reflects is that we don't understand exactly at the molecular or the cellular level what's going on with most PAH patients, because it's a clinical diagnosis defined by hemodynamics and exclusion of other secondary known associated causes. So the group essentially says that more work needs to be done, and of course we all know that more work needs to be done for deep phenotyping, in particular with respect to histologic abnormalities. The problem is we can't get biopsies in these patients, and so it's going to take an additional effort with maybe different avenues or different approaches to try and get us to that point. The next presentation I'd like to briefly share with you has to do with the obesity paradox. So more phenotyping here, and this is an observation that we've already been well aware of, that obese patients have better survival. And this group studied almost 70 patients and looked at obesity versus non-obese patients, and they found that despite worse hemodynamics, they actually had a better survival. So further reinforcing the concept that something about these patients underlying the phenotype of the obese patient may be protective. And they also offer the idea that because of these inflammatory, pro-inflammatory states that these obese patients are in, that they may have a better response to treatment. There's more to treat with our treatments for PAH. And the next presentation, also having to do with PV-domics, again with deep phenotyping, looks at the assessment of cardiac MR in the evaluation of the right ventricle by radiologists by and large. And what they found in over 700 patients that they looked at was that there was a good concordance between measures made by one radiologist versus another radiologist. However, there were some outliers, and there were clear differences in those methods that they used to evaluate the RV size and RV function. They found that mostly that as the RV grew, as the RV size or the disease, the PAH, got worse and the RV was growing, that there was less precision in those measurements. But they also found that the RV ejection fraction estimates were actually pretty concordant. So this is part of the PV-domics sub-study that is looking at the imaging basis for deep phenotyping in these patients. And I think it validates the concept that CMR is probably a great way to look at these patients, not only at an instant moment, but also longitudinally. And finally, the last presentation I want to share with you comes from a group of experts that treat pulmonary hypertension on a regular basis and particularly have expertise in the use of parenteral prostacyclin therapies. And this group did two things. One, they initiated a retrospective chart review to look at their use of parenteral prostacyclins in the low intermediate and high intermediate risk subgroups. And they also filled out a survey. And that survey was basically designed to ask the practitioners how they felt about prostacyclins and what their approach was to the use of prostacyclins. The survey revealed that, as expected, prostacyclins are an important part of therapy, and the expectation is that patients get better. Also, that just leaving patients alone and letting them be stable rather than improving them, even though they're only low intermediate or high intermediate risk and not high risk, is important to them, and that delay of using a parenteral prostacyclin therapy may lead to worsening outcomes. So the outcomes themselves showed that in the low intermediate group, about 17.5% got better. Most of them stayed the same. A few of them got worse. But in the high intermediate group, again, a group that is maybe suggested by guidelines to consider the use of prostacyclins, they had more than 50% improvement. And so the conclusion is that these patients who are benefiting from prostacyclins are probably benefiting even at a lower level, maybe earlier initiation, if you will, to prevent worsening and improve overall outcome. This concludes episode 2 of Clinical Clips here in Honolulu, Hawaii at CHEST 2023. If you'd like more information, it's there, download it, and you can see more content that came from this meeting. Mahalo.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.